Hi, in today's video, we'll talk about the scope of homeopathy for the treatment of lichen planus. Many of you may not have heard this word of this disease. It is lichen planus, and it is a common experience that unless one gets it, one never gets to know the spelling of the word lichen planus. Lichen planus is known to affect approximately 1.5% of the world population. It's an autoimmune disease which affects usually the skin, mouth, genitals, nails, and the scalp. My name is Dr. Rajesh Shah. I am a director of Life Force Homeopathy, and we are treating patients from across the world. We had significant experience in the treatment of lichen planus cases, and we have documented over 8,000 cases of lichen planus in last 35 years. Today I'm going to talk about what kind of cases of lichen planus they respond well to homeopathy and which cases do not respond to homeopathy. Well, if we talk about lichen planus on the skin, before that, let's talk about the causation of lichen planus. Lichen planus is an autoimmune disease. It is triggered by stress in many cases, not in all the cases. There are some chemical exposures, industrial exposure, which also could lead to lichen planus. And in many of the cases, we may not know the exact cause. It is unknown or idiopathic, as we call it. The scope of treatment using homeopathy, I would say it depends on several factors. Lichen planus on the skin can resolve very well with homeopathy. If it is only on the skin, the results with homeopathic treatment are excellent. Unless those cases which are what we call hypertrophic, they are extremely thick lesions or eruptions, especially on the legs or bony surface. These cases pose real difficulty and that cannot recover fully. Otherwise, lichen planus on the skin responds very well. Lichen planus in the mouth is more difficult to treat than lichen planus on the skin. Even inside the mouth, we have seen that lichen planus on the inner cheeks, they are relatively easy to treat than lichen planus affecting the gums or the palate or the tongue. Of course, in case of lichen planus of the mouth, one has to rule out malignancy or cancer by clinical examination and sometimes requiring a biopsy. Lichen planus on the genitals is equally difficult and sometimes more difficult than treating the oral lichen planus or lichen planus in the mouth. And of course, it is more difficult to treat than lichen planus on the skin. Lichen planus on the scalp, there's another variant of lichen planus which is called lichen planopilaris, whereby one loses the hair and there is a scar formation. And that variety of lichen planus is very difficult to treat. Now again here, if one has lichen planus only on the skin, it's easier to treat. If one has lichen planus in the skin as well as in the mouth, it's more difficult to treat. If one has lichen planus on the skin and in the mouth and in the private parts together, it is even more difficult to treat. So all these combinations make and increase the complexity of the disease and also reduce the chances of recovery in this variety of lichen planus. What can homeopathy do for the treatment of lichen planus? Well, I would say homeopathy has fantastic scope of treatment in most cases of lichen planus. On the skin, even if it is extensive, even if it is affected the legs and upper arms and back and abdomen, etc. on the skin, it can recover fully using homeopathy. Except the hypertrophied lesions, which may have been there for 10 years or 15 years, they are extremely difficult to reverse. Lichen planus in the mouth also respond very well to homeopathy. So is the genitals, but more difficult than those on the skin. We come across cases of lichen planus who have consumed immunosuppressive medicines such as cortisone in the form of either oral cortisone or topical on application of skin or steroids injections in the mouth or some kind of oral steroid mouthwash. If one has consumed corticosteroid for a long time, then it poses a great difficulty in the recovery of lichen planus. So we slowly reduce and taper off this kind of medications, and in that process there may be some resurfacing or some increase of lichen planus lesions because of stopping of the cortisone and not because of starting of homeopathic treatment. So one has to keep all these factors in mind. So all in all, homeopathy is strongly recommended for most cases of lichen planus, and the duration of treatment depends on the chronicity of the disease, the extent of the disease, the cause of the disease, the maintaining factors of the disease. But in general, we may say one may need treatment for about 1 year to 3 years or even longer if the cases are very complex. I believe this video will help to understand the scope of treatment with homeopathy for lichen planus, and this will help the practitioners, students, and general public as well. Thank you so much.